Thank you, Jürgen. You've all been very, very patient today because you've had to absorb a lot of information, a lot of points of view. So I want, just before we open it up, I want to just pose some very simple questions, which won't involve any slides at all, so you just have to listen to me. Why, what, who, how, and then if we get to those, how much and when. Now let me explain what I mean. Why? Well, I think everything that you've heard today gives you a sense of the dynamic in this region in terms of the demand for quality health care, but perhaps above all, the need to generate a flourishing pharmaceutical industry within the region for the benefit of the region, both in healthcare terms and in technology terms. So the why, I think, is answered. The what? GOIC, as you will have seen from the program, had a hypothesis that there were sufficient amongst you who would be interested in a multi-client study of some kind. Now let me just quickly distinguish what we mean by that. We've heard of stakeholders, and Jürgen has just enumerated them: governments, government agencies, manufacturers, the academic community, the science community, and not forgetting distribution, patients, and the economic and healthcare benefit of the region. I think all are represented here today. Some are headquartered in GCC, some may not be. But who those stakeholders are and how many of them are interested in undertaking a multi-client study is obviously a key issue, because as IMS knows and other consulting firms operating in this area, there are sometimes issues which are specific to one country or one state, or more particularly specific to one company. And we need to make sure that what we collectively agree makes sense from the region as distinct from something that makes sense individual for an individual company. So the what we do and who are these multi-clients is something that I would be very interested to hear views from. Thirdly, the issue of how. I mean that in two senses. How, once we've decided what we're going to do, how do we do this? Over what period of time? Who is involved in the work? And how is the process to be achieved? And then that leads on to the how much. How much is understanding? How much is achieving the objective worth to you? Now, I don't for a moment think we'll get to that, or for the matter of when this should be done, although I think the hypothesis is that sometime after this meeting, in the aftermath, when people have had a chance to reflect on it and to consult further, there may be some kind of core group who could actually put forward a specific proposal to the general body as to what makes sense. I'm not presuming that IMS will be part of that. We would be very happy to assist in that, as I think it will probably be clear. But I want to be honest, and I want to facilitate a discussion now, and also, frankly, to give you an opportunity to challenge some of the assumptions that we've been making, to present your own ideas as to how we might develop things. I think we're all agreed that something probably needs to be done. There may be a general drift towards generics, but maybe that isn't enough for the region. And let me just clarify one point, if I may. We've used the term generics fairly broadly. I'd like to make a distinction between commodity generics, which are the kind of generic products which are sold particularly in the US and Northern Europe. Typically, when a patent expires in those markets, within a year, 80 to 90% of that market will be satisfied. The volume in that market will be satisfied by generic products. Very low priced. Quality is presumed. They are sold purely on price. Now, that is not the case in most developing markets. It is certainly not the case here. What we mean by branded generics is not the branding of the product so much as the company. We've heard references to counterfeit. We've heard references to the perception of quality. Ultimately, the branded generics successfully sold in these markets are standing on the reputation of the companies selling them. And that reputation is based on a faith that their production and regulatory and compliance and quality standards are of the highest grade. Clearly, there are lower cost suppliers of these markets, of these products, particularly in Asia. But that doesn't mean for market success. They may be able to sell a cheaper product, but if the patient and the doctor and the pharmacist does not believe in that quality, then that doesn't matter. People want to be well, and they don't want to take something that they don't trust. The second point, if I may make on this, is the importance of the pharmacist, and that will continue to be the case in these kind of markets. Many people will go to a pharmacy and look at a range of products, some of which will be prescription products typically, some of which will be consumer products, and they will be, whether we like it or not, at liberty to choose that product, and the pharmacist gives it to them whether or not they've been near a doctor. So this is what I mean. Branded generics is a very important sector. I'm not undermining it, but we need to understand that it is, in terms of quality, in terms of sales and marketing, it's a very important issue. Okay, so if we go back to my questions, the why, the what, the who, the how, by all means raise any questions you've had about what anyone this morning has said, but if you can also help us move towards working out how we can take it from here. We may not get the answers today, but I believe at this first coordination meeting we can make significant progress. So if I could encourage you, please, to raise any questions to any of the panelists or to us collectively, and to share with us any of your ideas. Thank you.